This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. Multiple drug manufacturers are in different phases of COVID-19 vaccine trials as they race to help end this pandemic. But there's concern about how the speed of these trials and political rhetoric have affected the public's perceptions of vaccine safety. Coming up, we talk to Propublica about the process that exists to make sure a COVID-19 vaccine is safe. We'll also hear from Hartford Healthcare about its new center to treat so-called long haulers, people who are still experiencing symptoms long after they've tested positive for COVID-19. Dr. Ajay Kumar will join us to answer our questions and yours. First, who are the people you trust? Often they're family members or close friends, but relationships can blossom between people you see regularly, like your hairdresser. The City of New Haven hopes those kinds of relationships with your stylist or barber can help individuals who need more resources than just someone to listen to them. Joining us now on Zoom is Adriane Jefferson. She's Director of Arts and Cultural Affairs for the City of New Haven. Adriane, welcome to the show.
Thank you. Thank you so much for having me.
We know that this pandemic has taken a toll on the mental health of so many Americans. There's a Kaiser Family Foundation poll back in July that found more than half of all Americans say their mental health has been negatively impacted. So when we think about what's going on in each of our lives, and we think about the priorities that cities put on resources, talk through some of the conversations you're having with other departments in New Haven to help address the mental health needs of residents.
Yeah, absolutely. I think that what happened was we saw very early on, amidst the pandemic, a need for extreme focus on community well-being and mental health. This is something that we were talking about addressing head on prior to the pandemic. But when the pandemic came, it was exacerbated. And the mental health issues were particularly exacerbated in the areas where there are our most vulnerable populations and people of color. And so we really wanted to partner in an effort with the Community Service Administration under the Together New Haven brand that we created as our economic and resiliency efforts to help mitigate the damage of COVID-19. We wanted to make sure we always had a community well-being and mental health focus. And so as we were seeing these different issues arise and the trauma that was happening, we really wanted to partner closely to think about different alternative options to mental health for those in those most vulnerable populations and for those in the hotspots.
I mentioned you're the Arts and Cultural Affairs Director for the City of New Haven. And so why is your department part of this conversation?
That's such a good question. I think a lot of times when people think about a role such as mine, they usually keep it in the arts box. And really, my role expands beyond the arts. It expands to culture and how we shape culture, how we look at what we normalize, and how we are able to be present when it comes to inequities and address inequities head on. So we were already working on what I refer to as cultural equity. And what that means is not that just we're looking at arts equity, but that we're looking at the different areas that are impacted that cause people a barrier for being able to participate in the arts. So that means we would be looking at healthcare, we would be looking at transportation, we were looking at housing, right? Anything that's just a barrier to your normal everyday life, being able to address those injustices, correct those injustices, and then start to be able to address how people then also gain access to the arts. And so it's really a natural fit when you think about the fact that the arts and the culture can really connect with different cross sectors and be able to address these issues in a very, very unique way, which is why we were selected to be a part of this process.
Talk through how you confront the stigma that still exists in our communities when we think about mental health, and sometimes people are afraid to ask for help.
Yeah, no, that's absolutely correct. I think so. That's exactly why we wanted to come up with an alternative program, because there is a stigma that, not everyone's going to go to, the psychologist. Actually, not everyone's going to have access to a therapist or a psychologist, right? So we wanted to really begin to think about how do we do something that doesn't seem overwhelming, doesn't feel like pressure to speak, but that feels comfortable, which is why we were talking about the working with salons and barbers and working with clergymen and artists as a point of contact and as an alternative to going in to see a therapist, that these people would be able to identify any type of issues that seem to become something that they need to be aware of, be able to identify the signs so that they can then work with individuals who already trust them if they need more help and be able to direct them to the right resources. So this program itself does address the stigma because the stigma very much well exists. And I think, especially when you're looking at the Black and Brown community, the reason that the stigmas exist a lot of the time is because many times in these professions, people in the Black and Brown community do not see therapists and do not see psychologists and do not see anybody in that particular health profession that often look like them, right? Mm-hmm. So they already feel like people are not going to understand their specific issues, right? The things that they're dealing with, the traumas that may be in their life, in the very specific ways that their environment may be created. And so I think that perpetuates the stigma. And so that's another issue that we are looking to hopefully address in the future.
You're hearing Adriane Jefferson here on Where We Live. She's Director of Arts and Cultural Affairs for the City of New Haven. So you're really thinking about out-of-box ways to connect residents with resources that they may not even know about, but also working with community members like barbers and stylists who individuals trust to talk about their lives. And so I'm wondering how you get buy-in from hairstylists and salon owners and barbers to have the right tools so that when they're talking with their clients, that they're able to adequately address some of their concerns and point them to the right resources, Adriane.
Right. So the training itself is a partnership with HealthCare, who does this. They are the professionals who are situated under the Connecticut Mental Health Institute. Mm-hmm. And what they do is they have a training that's pretty much a behavioral health webinar training that anyone can take. You do not need to be a health professional to take this. And it's focused on education and awareness of substance abuse, mental health issues, and disordered gambling, and helping people to be able to identify and respond to the signs. So the training is actually the resource to be able to again, train people to be able to identify signs and to be able to actually feel like they are qualified to just do that. So I just want to be clear that this is not saying that this would take the place of therapy or those who actually need, further help and professional help. But it is saying that, so often we come in contact with people who may not be healthcare professionals, but you trust them more. So we want to be able to give those people the resources to be able to help so that they can really direct people who are struggling to the right resources.
So you're offering this type of mental health first aid training to hairstylists and barbers and other people in the New Haven community that could help connect residents to resources. So what has been the response? And if someone's listening now and wants to get involved, how do they do that, Adriane?
So we just launched this program probably about a week ago. And so the response has been trickling in a little slowly, but definitely people have been reaching out feeling like it's very unique and it's time for us to do programming like this. And so if anything, we've had a lot of people reach out who have other ideas on how to expand on this and are just really happy that we have an alternative program and that we're thinking in this direction. The city of New Haven has recently launched the crisis response unit as well, which is not something that I'm involved in, but it is just another example of the fact that we're just thinking about many different alternative options. So this is what the community has been asking for a while. I had chaired a community well-being group that came out of the Together New Haven efforts during COVID-19. And the Community Wellbeing Committee was nothing but residents who were from the most vulnerable populations. And the number one thing that came up was the need to address healthcare and mental health and community well-being. And so the response that we're getting, this is almost in response to that information we were getting from them.
And then again, Adriane, for our listeners who want to learn more, where's the best place to go?
I would say go to togethernewhaven.com and go under community well-being.
Well, Adriane Jefferson, it sounds like a great opportunity and initiative to get residents connected. I can't wait to follow up with you in a few months to see how it's going.
Great. Thank you so much.
Adriane Jefferson, again, is Director of Arts and Cultural Affairs for the City of New Haven. We'll also put a link up at our website, wnpr.org/where we live. I'm Lucy Nalpathanchel. Coming up, we speak to Hartford HealthCare's Dr. Ajay Kumar about COVID-19 cases rising in Connecticut. What questions do you have about a potential second wave in our state? You can join us, 888-720-9677. That's 888-720-WNPR. And you can also find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. On Friday, the governor said Connecticut's positivity rate was 2.4%, which reflects an increase in the spread of COVID-19 and the number of tests performed across our state. Hospitalizations are also up. Should we be worried? Joining us now on Zoom is Dr. Ajay Kumar. He's Chief Clinical Officer for Hartford HealthCare. Dr. Kumar, welcome back to the show.
Good morning, Lucy.
Our listeners can join us as well, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Coming up in a few minutes, I wanted to hear more about how Hartford HealthCare is helping treat so-called long haulers, people who have tested positive a while ago and still have symptoms because of COVID-19. But Dr. Kumar, I wanted you to help us interpret some of the data over the last month, where we know in Connecticut, our positivity rate was pretty low, under 1% for much of the summer. But since September, it's been slowly rising and now above 2% on Friday. How do you interpret this, and should we be concerned?
Lucy, thank you for having me. We should be concerned. We should always be concerned. We're in the middle of the pandemic, and we've seen through tremendous amount of discipline and focus across the Connecticut, I think we've maintained the positivity rate less than 1% for several weeks. And I want to remind the listeners that back in April, we had the peak of our positivity rate and the number of hospitalization. And since then, with a variety of work we've done, I think in June, we had seen the lowest number of hospitalization and conversion rate. And we maintained that momentum for a long time. In recent past, we've seen some increase in case reports, especially in the Norwich, Willimantic, and Hartford counties. And there's a possibility it might happen in Litchfield and New Haven as well over the next several days. It could be very much related to a variety of factors. One, because schools and colleges are opening, there's a bit more mobility among the people. It could very well be because there's some folks actually traveling and meeting the family and other members. But primarily it is because of the fatigue I'm finding, or at least we are finding among the folks regarding the mask use and hand hygiene and other precautions. So these are concerning trends right now. As of last Friday, I think we had 187 patients admitted in the hospitalization. Hospitalization rate is a single important factor to correlate with the mortality, number of patients who might die in the state of Connecticut. All the numbers are lower, but it is because the more younger people are being positive at this time. We've seen increased number of positive rate between 20 and 29 and 30 and 39. Now, these individuals don't always get admitted to the hospital, but these are individuals who are very mobile, and they can infect other members of the community who are very vulnerable. And in next few weeks, we might see further increase in hospitalization and increase in mortality. So yes, we need to be concerned, and we are watching the numbers very carefully at this time.
When you talk about in the coming weeks seeing higher numbers, is that because as the weather gets colder, people are socializing more indoors, and maybe, as you mentioned, this quarantine fatigue, not thinking about wearing their mask and social distancing, Dr. Kumar?
That is true, Lucy. We've seen through the patient interviews and other discussions we've had, we've noticed that folks actually are congregating indoors more. And generally, your folks are thinking this is a small gathering of friends and family. I know I hang out, my kids hang out, and they are gathering in a small setting right now, more frequently in an indoor setting, and that's causing spread at this time, and that's a common phenomenon we are seeing. I understand that the fatigue with mask and fatigue of social distancing is a significant challenge for our community. But it is actually very important that how we manage the pandemic at this time. I think the power of managing the pandemic lies within the people. If we continue to remain disciplined, if we continue to focus on simple measures, and when we are meeting with folks, wear the mask, social distancing, protect the vulnerable people, the things we've talked several times before, we cannot let our guards down at this time. It is important that we continue to pay attention to that.
You're hearing Dr. Ajay Kumar here on Where We Live. He's Chief Clinical Officer for Hartford Healthcare. If you have a question about the COVID cases that are rising in our state, the number 888-720-9677. That's 888-720-WNPR. You can share a comment on our Facebook page. Find us on Twitter at Where We Live. You mentioned that cases among young people have been growing. Do you think that because early on in this pandemic there was such a strong messaging about the dangers of this disease for older people that younger people think that they're invincible, Dr. Kumar?
That is true. I think there's some contrast from the March and April time when we had almost created a lockdown. There's a significant amount of folks actually were staying indoors, and the movement was limited. And with the change, which is rightfully so, I think we need to accommodate their concerns about the economy and folks getting back to work. We have let those principles a bit more relaxed right now with our reopening in Connecticut. And I think we were in the right place to do so, given the discipline we had noticed. But these individuals, what we're finding, especially young generation, maybe not adhering to the social distancing or mask procedures very well. So numbers are concerning if there's so many of the young ones are positive.
Mm-hmm. I mentioned the weather getting colder and more of us will be staying indoors, Dr. Kumar. And so if I'm hearing you correctly, you're telling people that they still need to be wearing masks, even if, it might be among family, because that's where you're seeing spread happening.
Yes, Lucy, I think the way I would describe, let me take a step back. I'm very supportive of social gatherings in an appropriate setting. I think that exposure is really important for mental health and other variety of reasons. However, if you're meeting the friends and family, and if you are you're not living with them all the time, make sure you sit or you have a gathering which can be accommodated in the right space you have. You're able to sit further apart. You're able to use a mask, and obviously protect the most vulnerable ones, the elderly, the immunocompromised, the folks actually who have some sort of autoimmune disease, who or diabetics who can get significantly ill in these times.
Now, I wanted to move on, Dr. Kumar, and talk about this new recovery center that Hartford Healthcare has unveiled. By now, people have heard this term long haulers, this idea that people that have been diagnosed with COVID and they've recovered, but then they're still having symptoms. And depending on the person, the symptoms vary. And I'm just wondering if you could talk more about this what people are experiencing and how your hospital system's working to help them.
Yeah, so I'm really proud of Hartford HealthCare's capability to be able to provide that kind of a programmatic approach to those individuals who are suffering from post-COVID symptoms. So we've noticed over the several weeks and in some publications, especially from Europe, and one was published in JAMA only in late September, indicating that up to 10% of the folks actually who have had COVID positive, irrespective of their hospitalization status, could continue to have a lingering symptoms. And symptoms could be very vague. Could be weakness, could be constant fatigue, could be muscle cramps and what we call the dysautonomia, that you're dizzy, you can't stand and walk. Some confusion, people feel brain fog, that they're forgetting things. There's some dermatological manifestations. There is a shortness of breath, unable to walk for long distance, chest pain. So a variety of symptoms we are noticing the patients are reaching out to our healthcare system. And our clinical team's been looking into that, and our team started putting the protocols across the state of Connecticut. As you know, we are present in almost all the cities and across the Hartford state of Connecticut. We have 400 plus centers. Mm-hmm. We have a very integrated approach of care, from home care to the nursing home to primary care group to urgent care to the acute hospitals. So our teams and institutes have defined a standardized protocol of managing those patients. So we have a very a standardized way of working. Because we have a wide variety of services, including neuroscience institute, heart and vascular, pulmonary medicine, integrative medicine, physical medicine, dermatological consultations, and a variety of things. What we have done now is to provide an ease of access to the patients, a single call-in number, 860-827-3200. The patient can call, they'll be appropriately triaged to the primary care or one of our specialists who are paying attention, who are treating those COVID patients at this time across the state of Connecticut. Now, the reason to create such a programmatic approach is, one, this disease is very new, and as I indicated, the patients are presenting with a variety of symptoms. Difficult to pinpoint how do you navigate the maze of healthcare. And if we want to make it simple, with our experts across the state of Connecticut, with our post-acute rehabilitation program, through our behavioral health network, through our different institutes, the patients get a standardized, appropriate care wherever they are in the state of Connecticut. And we are able to do that because we have a large system, and we are able to do that because we have experts who are paying attention to what is going on with the patient at this time.
Dr. Kumar, I wanted to maybe back up a little and talk about the individuals that are having these sustained symptoms. What do you know about, I guess, the demographic? Is it widespread, whether someone's in their 30s and tested positive and recovered versus someone in their 80s, that they still will have these residual symptoms?
Yeah, Lucy, we don't have a whole lot of data on this specific question at this time, but the data is emerging. I'll give you some stats at this time. About 80% of the patients actually who have those symptoms are not hospitalized. These are the individuals actually who never actually came to the hospital during the acute COVID crisis, but they were positive with COVID. We're seeing up to 2 to 3 months, at least on average, 2.5 months on average. Patients continue to have some sort of a symptom, so that's fatigue or shortness of breath and other things. Now, we haven't had much experience because as months go by, we will learn more. But there is a concern among some of the scientists that we would have this long hauler symptoms for several months to go by. So it's important to provide a comprehensive, integrated approach to care for the patients.
You can join our conversation with Dr. Ajay Kumar from Hartford HealthCare. The number 888-720-9677. Rebecca is calling from Rocky Hill. Rebecca, you're on the show.
Hello. My question relates to the schools. Since the schools have been opening, even though the numbers in the communities have gone higher, and it appears that Governor Lamont is willing to accept much higher numbers and still keep the schools open, how does that work to anybody's benefit? I understand that people do have to get back to work. I'm one of those people myself, but I'm not sure what the cost is in lives and medical costs.
Thank you, Rebecca, for your call.
Thank you. Rebecca, is a great question. Let me take a step back here to explain how, at least I think about the positive rate with the state is. Look, there's much to be proud of Connecticut, what we have done so far. The number of cases we have, the rate increase, and the decline in mortality in the last several weeks. We've done an excellent job in that part here. And compared to any other state in the country, or if you look abroad as well, the Connecticut actually is doing really well. And so it's always about balancing the risk and benefit at this time. In my opinion, the children needs to get socialization, needs to get education, needs to get the right amount of precautions. I personally think that most of the schools have taken a good measures to protect our children. With the plexiglass, the hand hygiene, the ventilation system, I think the governor and his team has put out a very sound policy so far. So I'm very supportive, and my children are going to school as well. I'm very supportive of that phased opening at this time. Now, if the positivity rate, which goes up, and we have a widespread infection in Connecticut, I think we may have a different conversation at the time. But again, I go back to that the fate of our recovery lies with the citizens of Connecticut. How well we take care of this precautions and other things we talked about earlier on.
Can we talk more about when you said, as you know, if our positivity rate continues to grow, and then that'll be a time to really start to think maybe we should pare back. So we're already seeing hot spots, say in Eastern Connecticut, Dr. Kumar. And so what is that number where local officials, superintendents to say, maybe we shouldn't be having our students in school?
It's not a single number from my standpoint. I think I will think about multiple metrics. One is the positivity rate and what age group we are finding that. The second one would be the hospitalization rate. Is how much hospitalization is occurring, which actually talks about the capacity of the healthcare system to be able to support the community need. We also need to think about how the flu gets into the whole mix here coming in the winter months. If we have a widespread flu, I think the conversation will be very different at that time here. So I think there are a variety of factors will come to place. I don't think there's a single number, at least I look at. However, the positive rate less than 5%, I'm pretty comfortable with that for the schools and other phase reopening process governor has laid out.
So you said less than 5% positivity rate. You said that.
That's right.
Okay. Liz is calling in from Southbury. Liz, you're on the show.
Hi, good morning. Thanks for taking my call. I was wondering, I have two children in preschool and in elementary school, and they have been doing an excellent job following all procedures. And I'm wondering, for the upcoming flu season, I hear a lot with parents that they say, oh, the kids are not going to get as sick this year. Flu season shouldn't be as bad because we're all socially distancing, wearing masks and whatnot. My son, though, about 3 weeks into school, did get a little cold and shared it with all of us. So I'm wondering, what is your opinion on the upcoming flu and cold season, and will we get it just like we have in the past, or will we see it being very mild this year?
It's a great question, Liz. So with the social distancing and face mask, we should see a milder flu season this year. However, if you don't vaccinate ourselves, it could lead to increased hospitalization. It could lead to increased spread. Even those folks, as we talked about earlier on, in the close social setting, the families and units of families and neighbors at the time here. And I think as we think about from the public policy perspective, our job is to limit the morbidity, mortality, and the hospitalization rate, which actually directly correlates, as I indicated earlier on, to increase suffering in the community. Mm-hmm. So the more folks actually takes vaccine, follow the procedures such as mask and hand hygiene, we should see a very low number of flu patients. That allows us to continue to focus on COVID, because pandemic is not going away in the winter, and we're going to have to continue to manage that. And from a social perspective, we want to make sure our healthcare institutions across the Connecticut are ready to support whatever the needs are. What we wouldn't want is a significant rise in COVID, which overwhelms the healthcare systems across the state of Connecticut, so unable to provide access and care to the individuals who need it. And at the same time, increased flu numbers because of lack of vaccination or lack of mask or use or social distancing. And that would cripple our healthcare system in the state of Connecticut significantly if that is to happen. And that would not be good for our citizens and getting through the winter. And it has direct correlation into a recovery effort and social well-being and mental well-being as well. So these are very important factors. We need to continue to pay attention to both of them equally.
Before the pandemic, each year, the number of Americans getting the flu vaccine it could have been improved. I'm just wondering, anecdotally, it seems like a lot of people are getting the flu shot this year. What is Hartford Healthcare seeing in terms of its patients and people that are coming in for regular appointments? Is it something that people are taking more seriously this year, Dr. Kumar?
It's very early to tell at the moment. It's still in the middle of October. I think generally we have seen as expected demand for the flu vaccination. It is not exceptionally high or lower at this time, so I remain optimistic that our citizens will take the advice very seriously and get the vaccine as needed.
I wanted to ask you before we end, Dr. Kumar, the state has an advisory group that's in charge of coming up with a plan to distribute a COVID-19 vaccine when available. I know Hartford HealthCare is part of this group. I'm just wondering if you could talk through how Hartford HealthCare is working with this advisory panel. And when we think about, come next spring or summer, if the vaccine, if there is a vaccine and if it's available, the logistics issues and demand issues that residents should consider to manage expectations.
Yeah, Lucy, this is a evolving discussion as we know. State of Connecticut has done, I think, a good job at presenting our thinking about how we are going to be managing the vaccine distribution across the state of Connecticut. I can talk about the Hartford HealthCare specifically. As you know, we have developed a significant logistical capability with the testing, with our mobile units, with our Go Health and urgent care, and variety of access points across the state of Connecticut. We've already prepared ourselves to make sure that we have the right amount of storage available. As you know, these two vaccines which are in the play right now requires ultra low freezing. And there's a significant challenge about how you actually transport those vaccines when they become available. So we have, in our work groups, have already created the possibility of distributing the vaccines through our channels. And we're very well prepared at this time. What we don't know at the moment, which is when the vaccine will be arriving, what we don't know about the entire safety profile at the moment. And we still are in the early stages of discussing who should get the vaccine as a first, who should be in the first in line to get the vaccine. Some guidelines has been provided by the state of Connecticut's task force, which I think are very sound and reasonable. Hartford HealthCare has team members actually who are included in this discussion. We are making sure that we continue to support the governor's effort at this time. This is going to be an interesting challenge for all of us as a community, but I'm very hopeful the vaccine, when it comes out, would help us manage the pandemic as we go further in the next several months.
When we think about managing expectations, obviously high-risk populations being the first to get this vaccine when it's available, Dr. Kumar. And so this idea that once a vaccine is available, we might have to still wear masks and social distance for the time being.
That is right. Vaccines capability requires that we will have a small amount of vaccine available for us initially, and then hopefully in the spring and sometime in May and June, we will have more vaccine available. So this pandemic is going to continue to challenge us for several months to go by. So we have to continue to follow the same precautions and protocols as we've been talking about. I do want to make sure that the vaccine's efficacy depends on the number of people get it. So the herd immunity concept, we need to have X amount of people actually who should get the vaccine to be able to create the barrier or reduce the spread of the COVID-19. I do want to remind the listeners, there is a good possibility we will continue to see this COVID-19 on every season over the time. And unfortunately, it's going to come back next year at this time. We're going to be talking about that again. So as we prepare ourselves, we have so many unknowns on the vaccine in the sense of duration, how long the immunity lasts, the safety aspect, and how many doses we need to take, probably 2 at the moment, what we know so far. So this is a evolving discussion at this time, and more as science evolves, we will know more. But on the positive side, having a vaccine available in such a short time is a testament of our scientific work, which is happening across the world right now. So there's a lot to be proud of, but at the same time, a lot to be cautious, a lot to remain cautious about as we go forward.
Dr. Ajay Kumar is Chief Clinical Officer for Hartford HealthCare. Dr. Kumar, thank you for joining us today.
Thank you, Lucy.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up after the break, we're going to talk more about the speed of these vaccine trials and how political rhetoric have both affected the public's perceptions of vaccine safety. We'll hear from a reporter from Propublica to explain the process to make sure that the vaccine, when it becomes available, is safe. More right after the break. This is is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up tomorrow, we're going to talk about election polling. What should we trust? That conversation on Tuesday. We hope you join us. Now, while the world waits for a COVID-19 vaccine, there are questions about vaccine trials, especially after the president claimed a vaccine could be ready by Election Day. But approval for vaccines takes time, and there are many hurdles that must be cleared before a vaccine is ready to be administered to the general public. To walk us through those steps, joining us on Zoom is Chen. She's health reporter for Propublica. Caroline, welcome to the show.
Hi, thanks for having me on.
So I know some listeners probably know last Friday, Pfizer said that they would not apply for emergency authorization for their vaccine till at least mid-November. So, Caroline, when that news came out, effectively, none of the vaccines will be approved before Election Day, something that President Trump said would be a possibility.
Yes, at this point, there's just no way that any of the vaccines that are currently being tested in clinical trials will be available before Election Day. It's just not going to happen.
Can you walk us through the vaccine approval process? Because the speed of these vaccine trials, in one sense, is a good thing when we want to see an end to the pandemic. But the general public, a lot of us don't really understand how these trials work, and there's a lot of concern. And also, we see vaccine skeptics stepping forward, saying you don't want to take this vaccine because it seems to be moving much quicker than the normal process. So can you walk us through the steps of the stages to make sure that these vaccines are safe before they're administered?
Yeah, sure. And there's a lot that goes into this, so I'll try to make this as clear as possible. So normally, vaccine trials can run for years and years. And so it's totally unsurprising that you might say, hey, how are we doing this so fast? And really the main part where speed is being generated here is actually because vaccines are being manufactured at risk. And what does that mean? What that really means is that millions of doses of vaccine are being made in preparation, even while the final stage trials, which is the phase 3 trials, are underway. So normally, it doesn't make any good business sense for you to start making millions of doses of vaccines before the final clinical trial is done, because, what if it doesn't work? What if the trial fails? You'd just have wasted a ton of money. So normally, what a vaccine maker will do is they will run the trials, and usually there are 3 stages of trial: phase 1, 2, and 3 human trials after you've done the animal studies. And then it's only when the phase 3 trial is done and you have a good result, then you go to the FDA, and the FDA says, yes, we're going to let you go on the market. And then you start firing up, your super big manufacturing plants. What's happening now for the COVID vaccines, though, is because we have a pandemic and we're in kind of a time press situation here, is that the manufacturers that are going into phase 3 trials are simultaneously starting the mass manufacturing process. And so that does mean that, if the trial fails, they're just going to have to throw away millions of doses. But that's an okay way to save time, because the only thing you're putting at risk there is money. And raw materials. You're not actually risking anybody's health or safety in that process. So that's a big time saver. And then with regards to what steps needs to happen is when you're in the phase 3 trial, which is where a number of these vaccines are right now, the trial has to run at the speed of the trial. You can't force it to run any faster. And when it reads out and you have a signal of whether or not the vaccine works, which is efficacy, you take that data along with safety data, which is how did people feel? Did they have side effects or not? And the manufacturer has to present all of that data along with their manufacturing data to the FDA. And then the FDA reviews it and decides whether or not they're going to grant, in this case, it's emergency use authorization to let it go on the market.
Caroline, many of us saw the headline that Johnson & Johnson's vaccine trial was halted. Can you tell us more about this and what happened?
Yeah. So for every trial, that is, you'll often hear, double-blinded, and you're like, what does that mean? And so what that means is if you go into a trial as a study participant, you don't know what you're getting. So in these trials, there's 30,000 people is pretty typical size. Half of them get the real vaccine, half of them get a placebo. The study participants don't know what they're getting. And the people running the study also don't know what they're who's getting what. And that's intended to make sure that there's no bias in the trial, and it's run in a super unbiased, and this is why it's called double-blinded, because both sides are blinded as to who gets what until the very end when it'll be revealed. Except there is this one special group, which is the Safety Monitoring Board, who does know who got what. And it's important that they know, and that there's this group that knows, because they can then track and make sure that there are no potential safety concerns or coming from the vaccine. So this special group, the Safety Monitoring Board, looks out, and if anybody reports a side effect that is known to be related to vaccines, they can look and see, did that person get the real vaccine and not a placebo? And if they have any sort of concern, they can say, we're going to pause the trial, or we're going to stop enrollment for a little bit and just take a look and see, are we concerned that this is caused by the vaccine? We're going to maybe check in with all the other participants and see, did other people have this side effect? Now, sometimes this can be a little bit tricky because, there are side effects, which could come from a vaccine, like a high fever, which could be caused by, I got a really bad cold, or I got, another virus that I picked up, which is not caused by the vaccine. So, these are experts that have to try to distinguish, is this something that came from the vaccine or is it unrelated? And so when I see a trial that gets paused, to me, I don't think, oh my gosh, there's something wrong with the vaccine. To me, I think this is very normal, especially in a trial this large. And this means that the Data Safety Monitoring Board is doing their job. And you can't read into it, because it could be totally unrelated to the vaccine. It could be related to the vaccine. And it just means that they're doing their job. And I'm glad that there's good oversight.
That's a good point that you raised, Caroline, because when that Johnson & Johnson story came out, that their trial was halted, I saw on Facebook people sharing this and using that as a basis to say that people should be doubtful of the process. And it does raise questions that the general public doesn't really understand how vaccine trials work. And that's why it's so important to have this information handy so that people understand it, that they shouldn't be worried.
Yes, absolutely. And I think this is why it's so important to let trials run to their conclusion, because they are designed both in terms of the size that they are and in terms of, the length that they run, to be able to really show, with statistical significance, whether or not a vaccine works. So these are all calculated in order to be able to say definitively or not, this works vaccine compared to placebo or not. And they calculate the numbers so that, to me, the most important thing is that when the data comes out, that we have that sort of statistical significance. And, the FDA has promised, and I think this is so important, that any vaccine candidate that gets submitted to the FDA will be presented to an outside panel. They call this an advisory committee of outside experts. This will be in a meeting that is public. Anybody can dial in and listen to it. It'll probably be a little bit, like wonky, but it's really important that it's public here. And because these experts are not FDA employees, they're not government employees, they're just outside experts who will kind of talk through the data. They'll ask questions to the vaccine manufacturer. It's all on the record. And then the advisory committee gives a recommendation to the FDA to say, yes, we think this is safe, we think this is effective, we think you should let it on the market or not. And it is just a recommendation. The FDA can do something different. And in the, historically, usually the FDA follows the recommendation. There have been instances where the FDA has gone the other way. But I think in this case, there's going to be so much attention on these vaccines. I don't think the FDA can go against the recommendation of the advisory committee. So I will certainly be watching these advisory committee meetings with a lot of interest. And I think it's great that the FDA has committed to having these public meetings, to go over the data publicly in front of the world.
We heard Dr. Ajay Kumar earlier say that when a vaccine becomes available, people may need 2 doses. And so then we're wondering about the efficacy, and what do we know about how effective a vaccine could be? Is this something that we'll need to get every season like we do the flu shot, Caroline?
Yeah, these are all fantastic questions. So let me just quickly address the 2-dose issue. So there are some of the vaccines, so Pfizer's and Moderna's, so those are likely the first 2 that will come to market, are designed to be 2-dose vaccines. So then there are others that are sort of coming up behind. Johnson & Johnson's is a single-dose vaccine. So these are just based on the scientific technology behind the vaccines. And, it is how they're designed to reach their full potential. 2 doses, of course, is logistically more difficult. And, we're going to have to make sure that we have systems set up so we can track, let's say I got the first dose of the Pfizer and the Moderna is already on the market. So, I can't go back and get a second dose of the Moderna. I'm going to have to make sure that I get the right second dose and that I go back and get my second dose. So that's a whole other issue for once they're all out. But in terms of efficacy, I think one thing that's really important for the public to understand is that we need to wait and see what the data look like and really have a clear message go out as to how good these vaccines are, because there are some vaccines we have, that we receive, like the measles vaccine, which are pretty much close to 100%. It's like 97% if you get the doses, both doses, that it really prevents infection. So like if you've gotten the measles vaccine, you can't get infected with measles. It's what they call it sterilizing immunity. So it's really, really effective. Compare that to the flu shot. We all know year to year, because they're kind of guessing at what flu strains are going to be circulating. It can be like 50% effective. And that doesn't mean don't get the flu shot, because it can still help you, if you get the flu, have a less severe course of the flu, so you don't end up getting hospitalized. So there's still value there. But the coronavirus vaccine may end up somewhere on that spectrum. And I think what, a lot of people I've been talking to have been saying, we hope it's around like 70, 80% effective. But that we'll have to communicate that to the public. And you might have to understand that this can help you prevent you from getting severe illness, from being really sick, but it may not prevent you from getting infected in the first place. So we'll have to see what we get. And that's why these trials will answer these questions for us as they come out.
I love the line in your story, one of your stories, Caroline. Getting shots in millions of people's arms is a whole nother story. We hope to have you back to talk about that. Yeah. Again, the logistics of getting this vaccine to millions of people. But we appreciate you explaining this to us. Caroline Chen, again, is health reporter for Propublica. We will tweet out links to her stories at Where We Live. Caroline, thank you.
Thanks so much for having me.
Today's show, produced by Carmen Baskoff. I'm Lucy Nalpathanchel. Thanks for listening.